Managing genital symptoms depends on the underlying cause of the symptoms, which may vary from infections to irritation or more serious conditions. Common genital symptoms include itching, pain, discharge, sores, swelling, and discomfort. Proper management often involves a combination of hygiene practices, over-the-counter treatments, and, when necessary, medical intervention. Common genital symptoms and potential causes: itching. Causes: yeast infections, bacterial infections, sexually transmitted infections, STIs, allergic reactions to products like soaps, detergents, or condoms. Management: maintain proper hygiene with mild, unscented soap. Wear loose, breathable cotton underwear. Avoid douching, scented products, or harsh detergents. Use antifungal or antibacterial creams for infections as advised by a healthcare provider. Pain or discomfort. Causes: infections e.g., STIs, yeast infections, irritation from clothing or sexual activity, skin conditions e.g., eczema or dermatitis, or medical conditions like endometriosis. Management: use over-the-counter pain relievers e.g., ibuprofen. Apply cool compresses for temporary relief. Avoid tight clothing or activities that increase irritation. See a doctor for persistent pain, especially if it's associated with urination or intercourse. Abnormal discharge. Causes: bacterial vaginosis, yeast infections, STIs e.g., gonorrhea, chlamydia, or hormonal changes. Management: see healthcare provider for a diagnosis and proper treatment. Use prescribed antibiotics or antifungal medications. Maintain hygiene, and avoid scented soaps or douches, which can disrupt the natural balance of bacteria. Sores, bumps, or ulcers. Causes: genital herpes, syphilis, warts, HPV, or non-infectious causes like cysts or allergic reactions. Management: apply antiviral medication for herpes or antibiotics for syphilis after proper diagnosis. Keep the area clean and dry. Avoid sexual activity until a diagnosis is made and treatment has begun. Consult healthcare provider if you notice sores, blisters, or warts. Burning sensation. Causes: urinary tract infections, UTIs, STIs, or chemical irritation. Management: stay hydrated and urinate frequently to flush out irritants, especially in cases of UTI. Use pain relief products like urinary analgesics e.g., phenazopyridine for temporary relief of UTI symptoms. Avoid irritants like scented soaps or lubricants. Seek medical attention for a diagnosis and appropriate antibiotics if necessary. Swelling or redness. Causes: allergic reactions, infections, trauma, or inflammatory skin conditions. Management: apply a cold compress to reduce swelling. Use antihistamines if the cause is an allergic reaction. Avoid irritants and wear loose clothing to allow airflow. Seek medical advice if the swelling persists or worsens. Odor. Causes: bacterial vaginosis, yeast infections, poor hygiene, or retained foreign objects e.g., tampons. Management: maintain good genital hygiene with water and mild soap. Avoid douching, as it can worsen the balance of bacteria. See healthcare provider if the odor is strong and associated with discharge or itching for appropriate diagnosis and treatment. General management tips for genital health hygiene. Clean the genital areas daily using warm water and mild, unscented soap. Avoid overwashing, as it can irritate the skin and disrupt the natural bacterial balance. Always wipe front to back after using the toilet to avoid transferring bacteria from the anus to the genital areas. Clothing. Wear loose, breathable fabrics, preferably cotton, to keep the area dry and reduce the risk of infections. Change out of wet or sweaty clothing like after exercise as soon as possible. Sexual health. Use condoms to reduce the risk of STIs. Practice safe sex and communicate with partners about any symptoms or concerns. Get regular STI screenings if sexually active, especially with new or multiple partners. Irritant avoidance. Avoid using products that can irritate the genital areas, such as perfumed soaps, lotions, bubble baths, or certain laundry detergents. Avoid tight clothing that may cause friction or trap moisture, leading to irritation or infections. Hydration and diet. Drink plenty of water to keep urinary tract healthy and help flush out toxins. Maintain a balanced diet to support immune function and overall health. When to see a doctor. If symptoms persist for more than a few days despite self-care. If symptoms are severe or worsening, e.g., intense pain, large sores, heavy discharge. If you suspect you have an STI, or if symptoms are accompanied by fever, chills, or general malaise. If you experience frequent or recurrent symptoms, as this may indicate a more serious or chronic condition. Conclusion: managing genital symptoms often involves a combination of good hygiene practices, over-the-counter treatments, and consulting healthcare provider when necessary. Early diagnosis and treatment can prevent complications, particularly in cases of infection or chronic conditions. If unsure about the cause of symptoms, seeking medical advice is essential for appropriate care.